So I went ahead and reviewed the patient's chart, and I found that she had a right knee strain. So the main goals in treatment were to increase the range of motion, flexion, and extension up to 10 degrees. And then also she had some muscle weakness for flexion and extension as well, so just increasing that muscle strength as well. So today I plan to assess both the range of motion and the muscle strength, and then also provide her with some exercises to do at home.
Okay, thanks.
Let me go ahead and wash my hands.
Kelly, you can go ahead and have a seat on that table. It'll be great. Thank you.
Roberta?
Yeah.
Hi, Roberta. My name's Lana, and I'm your physical therapist assistant. Hi, how are you feeling today?
I'm alright.
You're okay? Okay. I've gone ahead and reviewed your chart, and it looks like your therapist wants us to work on some range of motion and also some muscle strength in your knee.
Okay.
Has it been bothering you quite a bit lately?
Yeah, it really has.
And how would you rate that pain?
It's just really hurting like in the back.
Really hurting in the
Yeah.
back. Could you rate it on a scale of 1 to 10?
I say right now it's like well, it's about a 3 or 4.
A 3 or 4? Okay, excellent. So that's not too bad. We'll see how it is with the motion, though, if that bothers it at all. Has there been any changes in your medical history?
No.
Otherwise, no? Okay, well, I'm just going to go ahead and grab a couple of things, and then we'll go ahead and get started. Is that okay with you?
Yeah.
Okay. So Roberta, actually, first, if I can get you to, see, lie over, I'm going to bring these pillows over here. If I can get you to lie on your back. Like this? Yeah, that's perfect. Thanks, yeah. One of the problems of being tall, I guess. Okay, so the first thing I'm going to do is actually assess your range of motion, and to do that I just have to make a couple of points on your leg. And one of those points is up on your hip. Would it be okay if I draped you just so I can access that point?
Yeah.
Okay. So I'm going to put this towel here. If I can get you to actually tuck it under your shorts here, or if you don't mind me doing it. Excellent. And I have my waterproof marker, or my washable marker here. Is it okay if I make a couple of points on you?
Yeah.
Okay. Let's see, so the first point here is actually just on your ankle. Okay. Next point's going to be up here on your hip. I get you to move your toes back and forth there.
Like this.
If I can get you to move on this way. And then this way. Okay, as much as possible. I know that's a little painful for you, so if it's too painful, then alright, the next one's just down here on your leg. I know it's hard for you to move that knee up and down, so I'll try to find it. Okay. So what I'm going to ask you to do, Roberta, is actually bring your knee up as much as possible. And you're going to slide your heel back. Just do that once without the tool, as much as possible. Okay, it's a little bit tight. Can you move it any farther? Okay, good. Excellent. Why don't we try to relax it again? So if you want to drop your heel back down and set the tool up. Okay. So if you want to go ahead and try to do that for me one more time.
Come up.
Come up as much as possible. Okay, can you push it any farther, or is that pretty painful?
That's about all I could go.
Oh, okay. How would you rate your pain right now?
It's about an 8.
An 8? Okay. All right, why don't we go ahead and come back down. It looks like you're at about 59 degrees. All right, so next we're going to try to extend your knee as much as possible, and I know that's pretty painful for you as well. So what I want you to do is try to go ahead and push down as far as you can on my hand. All right, that's pretty good. All right, we're going to do the same measurement. Perfect. On the count of 3, I just want you to push down as far as possible on this hand. 1, 2, 3. Okay, excellent. So it looks like there you're at about, let's see, 17. Negative. Okay. So moving on, if I can actually remove this towel here, lower you down just a little bit. All right, if I can get you to sit up again, we're going to do some muscle testing. Perfect. Have you done this before?
No.
No? Okay.
Well,
Yeah. Yeah? Okay.
maybe they did it last time. I don't remember.
You don't remember?
I'm sure they did.
Okay, okay. I was going to say, the therapist said he's been assessing your strength, but he could have been doing it as well.
Oh, I kind of did see his phone.
Okay, so we're going to be working on knee extension. So this is basically, it's a grading scale. What I'm going to ask you to do is extend your knee as much as possible. I know we have it's a little bit sore there. And I'm going to push down at your ankle. And when I push down at your ankle, I want you to try to resist it. So try to keep your legs straight as much as possible. Okay, and you can lean back on the table, kind of give yourself some support. Your knees are already flexed. So on the count of 3, and I want you to try to hold it for 3 seconds. Okay? All right, so 1, 2, 3. Okay. All right. So that's a graded 2, so I'll record that in your chart. And then talk to the therapist about what he wants to do with that and work on some strengthening as far as extension goes. Okay? All right. And if I can actually get you to lay on your stomach on the bed again. Or on your stomach.
Just with my head at this end.
With your head at this end. Or, actually, I'm sorry, with your head at this end. Sorry about that. Okay, so this is a similar test. Kind of just test some different muscles. So what I'm going to ask you to do is actually raise your heel to the sky as much as possible. Okay. So what I'm going to do, Roberta, is actually pull back on your ankle, and I want you to try to keep this leg bent as much as possible for 3 seconds again. Okay? All right. So on the count of 3. 1, 2, 3. So, let's see, I'm going to grade you at a 2 for that. Okay, perfect. So now the give you some exercises to work on at home. If I can get you to flip over on your back again, you're fine in the position you're there, or there. Okay, grab my phone roll here. So I'm going to place this.
If it's your
on
time, you
left
can come
knee.
in.
I'm going to lift your leg up and try to assist you a little bit here, okay? All right. So this is just to kind of strengthen some of these muscles that are associated with your knee, okay? So what I want you to try to do is raise your heel up as much as possible and engage these muscles in the thigh.
Like this?
If you can raise it up and then bring it back down. If that's as much as you can do, yes, that's correct. And really try to engage these muscles here. Very good. Okay. And I just wanted to make sure you were able to do that. So kind of when you're laying in bed at home, you can roll up a pillow and put it under your knee, and then just work on doing that anytime you get a free second on the couch or anything. So it'll really help you out if you can do that. So I'm going to remove this foam roll here. Help you there with your leg. And now we're just going to kind of try to stretch some of those muscles out, okay? So this is kind of an opposite of our last exercise. So what I'm going to do is place my hand under your knee. And just like we kind of did in the test, to test the angles of your knee, I want you to press down at my hand. Do you feel a slight stretch in the back of your leg? No? Okay. Do you feel any kind of stretch? In the back of your thigh.
Okay. So just
A little stretch? Okay. We're just looking for little improvements. So yeah, if you can just do that and try to push your knee down at your bed or your couch again as an exercise to do at home. Okay, all right, excellent. So everything kind of makes sense as far as that goes? Yeah. All your exercises for at home. I think it'll really help you out and be really beneficial for you. Okay. So, okay, excellent. I'm going to lower you down. You can go ahead and sit up. Have you check out with the assistant up front, set up your next appointment. And I'm excited to hear about your progress as well.
Thank you.
So, thank you.
So Lana, if you said this already, I missed it, but can you tell me what the normal ranges are and what you measure? It's okay, come on over here in front of the camera.
Okay. For extension, normal range is, 0 degrees is normal. Sometimes there's a degree of hyperextension.
Sure, and how about flexion?
And flexion is 135 degrees.
Okay, super. So there's one of these scenarios, you can just pick one.
Okay.
And then just we're going to face the question over in front of the camera so Beth can see it. Yep, and so come on a little closer with it. Okay, and so go ahead and turn that over and answer that question, please.
So I would say to check if the patient has been compliant with the home exercise program. You'd be able to tell by the patient's progress, possibly from the last session. So if the patient hasn't progressed, I would say that would be an indication. But the first thing you should do is just ask. Yes, because most people should be honest with that, I would think.
All right, thank you.
Yeah.